Welcome back, dental assistants, to Lecture 3, Infection Control for the Dental Assistant. Now, I will warn you, this lecture tends to be one of the lengthier ones, but it is incredibly important. So as we review it, and there will be parts where you'll read on your own, it is incredibly important to take your time to get through all the information. So let's start with the infectious diseases and disease transmission. First off, the patient medical history is an invaluable document. It is not reliable as the sole method for identifying, though, all infectious patients. Diseases, though, with the particular potential to spread in a dental office that we must be aware of are hepatitis B, hepatitis C, AIDS, herpes simplex, and tuberculosis. Now let's discuss the definition of a disease. An organism's method and response to some type of injury. A disease typically causes some form of cellular disorder or function. A lesion is a broad term that encompasses tumors, ulcers, sores, and tissue damage. Next, let's discuss the diseases that can be spread in the dental office and the methods of protection. I am now going to let you read about these diseases, starting with tuberculosis and going all the way through with HIV and AIDS on your own now. The following slides you will see will also help you fill in the needed information as you read on your own right now. Because these are infectious diseases that can be present in the healthcare setting, it will be important to know how to don your PPE or personal protective equipment. And you need to know what this stands for, dental assistants, as I promise this is going to be important every single day. PPE is designed to protect the dental healthcare professional's skin and mucous membranes from blood, saliva, and other potentially infectious material. According to the Office Safety and Asepsis Procedures Recommendation, or OSHA, PPE should be applied in the following sequence: eyewear, face mask, and then gloves. Your gloves help to minimize cross-contamination from patient to patient, patient to dental personnel, and from dental personnel back to a different patient. Gloves should always be worn during all intraoral dental procedures or when it comes to handling objects that have come in contact with blood or saliva. According to the CDC, standard precautions must always be taken. In other words, it's important to treat every patient as though they could have an infectious disease. I will now let you read over the types of gloves that are used in dental offices on your own now. Now let's discuss the protective garments worn by dental assistants. First, disposable gowns are the best design for a protective gown, and it can be knee-length and made of fabric that resists moisture, breeze, and serves as a very effective barrier. These gowns should be discarded daily, but are thrown away if visibly soiled. Many offices use reusable gowns, and this is also referred to as a lab coat. It is made of a reusable cotton or cotton polyester blend. OSHA's bloodborne pathogen standard states that it is the responsibility of the employer to launder reusable protective garments in office. If contaminated laundry is transported away from the workspace, it must be contained in water and leak-proof bags marked with the universal symbol, including biohazard material. Face and eye protection are incredibly important. Face masks, according to the FDA, in order to be effective, they must have a 95% bacterial filtration efficiency. It is strongly discouraged to allow the face mask to hang around your neck, to pull down around the chin, or reuse with different patients. Once a mask has been used, it will be contaminated with spatter and blood from the previous patient. So reusing can cause cross-contamination to other patients or to the dental professional. Protective eyewear is used to shield the dental professional from blood, splatter, airborne contaminants, and caustic agents and projectiles. OSHA requires that the protective eyewear have front and side protection with solid side shields. Some offices choose face shields, and they cannot be used as a substitute for a face mask, but they may be used as a substitute for protective eyewear. The shield must meet the standards of the American National Standards Institute of Occupational and Educational Eye and Face Protective Standard. The principles of personal hygiene and personal protective equipment is what we will discuss now. It is important for dental care providers to be aware that they can potentially carry infectious agents from patients to other patients, as well as to family members, co-workers, and other members of the community. Personal hygiene principles that decrease the possibility of cross-contamination include: your hair should be pulled back and secured to prevent falling forward and into the operating field. Nails should be kept clean, short, and often in offices they recommend free of polish. Your uniforms should have sleeves short enough to easily wash your hands and forearms. Then that overgarment will go over your forearms and cover all areas that are susceptible to being sprayed or splashed by bodily fluids. The overgarment must be removed prior to leaving the dental office and laundered at a temperature of between 140 and 160, separate from other dental items. Jewelry. Watches, rings, bracelets must be removed always prior to donning of PPE. It is impossible to remove bacteria from these items, and they can potentially carry infectious microorganisms. I will now let you read the proper hand washing procedures, as well as the different soaps and disinfectants to be using in your dental office right now on your own. Now let's discuss more about infection control. It is imperative that dental assistants are in compliance with correct infection control measures, correctly utilizing barriers in the operatory, and correctly decontaminate soiled surfaces and the use of appropriate PPE. I will now let you read on your own the agencies that regulate the safety of materials that we use in our dental offices. Read all the way through to the different hazardous materials found in dental offices, and I will pick back up with you in the section on toxic chemicals. So let's review the infection control general guidelines. Sterilize any equipment that can be sterilized. Use barriers whenever possible to prevent contaminated surfaces. Use disposable plastic surface barriers, chair covers, dental light covers, air-water syringe covers, patient barriers, a patient napkin, use of protective eyewear for both the clinician, the dental assistant, and the patient, personal protective equipment, gloves, and face mask. Utilize disposables whenever possible to save time and decrease the possibility of contamination. This includes dental dams, protective eyewear, uniform, and protective overgarments. I will now let you read on your own about the biohazardous waste disposal and non-regulated waste disposal. I will also let you read on your own about OSHA regulations for infectious waste materials, as well as the immersion, chemicals, and surface disinfection. You will finish with reading on your own all the way through the spray, wipe, spray technique. You should have just finished reading about the steps of the spray, wipe, spray technique. Now, let's discuss the importance of transporting contaminated instruments as soon as possible. As soon as possible following all procedures, contaminated instruments should be transported to the sterilization area in a leak-proof container with a solid bottom and solid sides. Every attempt should be made to transport as quickly as possible following the procedure and before the soiled instruments have dried. The hand scrubbing of instruments is incredibly important. Prior to the use of the ultrasonic cleaner, instruments with a large amount of bioburden on them should be hand scrubbed. Instruments should be hand scrubbed in a basin of soapy water. A long handheld brush should be used while scrubbing 1 or 2 instruments at a time just above the waterline. It is important to be able to visualize the instruments so that injuries can be prevented. After instruments are scrubbed, they should be rinsed in cold running water. Keep splashing to a minimum will help to minimize the spread of pathogens. Instruments can now be dried with a paper towel and be prepared for sterilization. Ultrasonic cleaners utilize a process called implosion, in which sound waves form minute bubbles that collapse into themselves in a special solution. The mechanical removal of debris, called cavitation, is what allows the ultrasonic cleaner to reach areas that hand scrubbing cannot. Once the ultrasonic cycle is complete, the basket containing the instruments must be rinsed using cold water. Any instruments still containing debris should be manually scrubbed again. This disinfecting agent in the ultrasonic cleaner must be changed at least once per day. In many practices, instrument cassettes have taken the place of procedure trays. When cassettes are placed in the ultrasonic cleaner, care must be taken that the whole cassette is completely submerged in the solution. An enzymatic cleaner helps to dissolve the bioburden. When the ultrasonic cycle is complete, the cassette should be held at an angle and rinsed under cold water. After rinsing, the cassettes should be opened and inspected for cleanliness. If any bioburden remains, hand scrubbing may be necessary. I will now let you read on your own the sterilization process of killing all microorganisms and pathogens. Read through the 5 different ways now. Packaging and labeling of instruments is incredibly important. It is important for these instruments to be packaged loosely enough to allow steam to then penetrate the surfaces during autoclaving. Instruments should be pre-packaged using bags or wraps prior to sterilizing. The instrument bags or wraps should be labeled with the contents of the package as well as the date of sterilization. Storage of sterile packets. Unopened sterile bags, wraps, trays, and cassettes should be stored in a closed drawer or cabinet until ready for use. Sterile packets will remain sterile for up to 3 months if well protected. Due to the possibility of equipment malfunction as well as human error, it is recommended to monitor and record sterilization methods at least once per week. There are 3 methods of monitoring that I will now let you read on your own. Stop reading when you get to the compliance with bloodborne pathogen standards, and I will meet you there. Compliance with bloodborne pathogen standards. To comply with the bloodborne pathogen standard, dental personnel must comply with the following. Universal precautions for all patients. All patients must be treated as if they have a contagious infectious disease. Contact with blood or other infectious diseases must be prevented. Engineering and work practice controls. Controls that isolate or remove the bloodborne pathogen hazard from the workplace includes PPE, proper hand washing, eye wash stations, proper recapping of needles, only one-handed or using a mechanical device to recap, no eating, drinking, smoking, applying lip balm, handling contact lenses in any area of possible exposure to blood, saliva, tissue, or other infectious diseases. Housekeeping management. Our work sites must be maintained in clean and sanitary conditions. A written schedule is recommended to maintain a safe, clean, and decontaminated facility. I will now let you read the rest of the material up to the end on your own. The PowerPoint slides will help you follow along and fill in the blanks. I'll meet you back at the end of this lecture. As you now see, it is extremely important to always wear PPE, follow universal precautions for all patients, and know all your office's hazardous material and injury policies. Please ensure you direct any questions in regards to this lecture to your instructor.